Unit 4, Promoting Health in Patients with Immune Disorders. We have 5 chapters. 18, Assessment in Immune Function. Chapter 19, Coordinating Care for Patients with Immune Disorders. Chapter 20, Coordinating Care for Patients with Connective Tissue Disorders. Chapter 21, Coordinating Care for Patients with Multi-Resistant Organism Infection Disorders. And Chapter 22, Coordinating Care for Patients with HIV. So now in this video, we'll present Chapter 18, Assessment of Immune Function. Med-Surg chapters are about 50 pages long, and half of the time you can't tell what is important. This video will help you to see it all fast. If you are a nursing student, this could save you hours of rereading. And if you are here just to better understand the conditions, I hope this makes the topic feels less intimidating. Hi friends, and welcome back to my channel. I am Nurse Mia, and this is part 2 from the Med-Surg RN chapter, the outline from the GetsZen RN study group series. Before we get into the details, I always like to zoom out first to look at the big picture of the chapter. I use a concept map like these to break it down heavy chapters so you can see the full path of disorders, lab intervention, all at a glance. You'll know exactly where to zoom in and what to prioritize. It takes the pressure off and makes the chapter easier to follow. Comment below which section of this chapter feels the most overwhelming for you. The goal? One page of clarity you can revisit in minutes. A map turns 60 pages in 10 minutes of review. Clean path, less noise. You will know where to start and what to skip. Let's get started. So, welcome to chapter 18, the outline. So, I hope you like my new PowerPoint slides. I'm going to use those style for this unit, for the immunity, and let me know if you like it. So we have the chapter overview, which provides an overview of the immunity system's purpose, function, and role in protecting the body from pathogen and foreign substances. Also emphasizes the importance of immune assessments in early detection of immune disorders like immunodeficiencies, autoimmune disorders. So overall, the introduction is that we know the immune system, it's a continuous surveillance network against infections and diseases. Collaboration between lymphoid organs, specialized immune cells, and immune responses. Integration with other systems, circulatory, respiratory, gastrointestinal, protection against microbial invasion. So here it's my little map. This is typed manually. It's typed manually. Finally, I learned how to make in smart art. It's that function in Word and Excel and PowerPoint. So, but I had a long time ago, and I remember typing in it and making this. Oh my goodness. Um, so you see introduction, I talked about it. The next is overview of anatomy and physiology. So chapter 18, like every chapter in Med-Surg RN, will have a chapter assessment. So the assessment of that unit or the diseases will talk about the anatomy and physiology and diagnostics, some assessments, lab, kind of an overall, and then the rest of the chapters, 3, 4, 5 chapters that come along, will talk about specific areas. So the 18 is assessment. Of course, it's anatomy and physiology. So I divide anatomy and physiology because they talk, here you see they talk this. I type it manually. I found some nice pictures online, but it's very important. I take my light out. So you can take short screen. So this is basically the brain map. This concept map, actually, if you read it short screen, then you'll see what area you need to work on, and then you go to the chapter and you just, you're gonna find out your area where you lack. So as you see, then after anatomy and physiology, we have the assessment. Like every chapter will have the assessment. So it's 3. And then here, like history, physical examination, inspection. So this is always we do, always and forever. Always and forever. Then the diagnostic studies, when you perform an assessment, you see the patient, then you need the diagnostic studies, and then with nursing implications. And then also many chapters in this book has age-related changes, because they focus a lot of the elderly, since nowadays the population it's higher in elderly, and that's why they say elderly above plus 65, and almost each chapter they talk about this. So you're gonna see this always. This is always, you're gonna see this. Okay, and these also you're gonna see always on the assessment chapters. So we have here anatomy. We have here anatomy, and here it's physiology. So this is 2 here because it's too big. I divided in here. And then as we go, you can see my map. So we go one by one. So overview of anatomy and physiology. Probably it's redundant since we are in nursing, but the quizzes, they are very detailed about this in class. So there are components of the immune system, which includes the lymphatic system, primary and secondary lymphoid organs, and the cells and proteins involved in the immune response. So the lymphatic system contains of lymphatic vessels and collecting ducts. And here you see I made like more detail. So the anatomy of the immune system is the lymph nodes and lymphatic system, which filters the lymph and traps pathogens. For instance, the cervical nodes swell during throat a throat infection. Spleen filters blood, removes old red blood cells, and stores the white blood cells, important in systemic immune response. C. Bone marrow, site of all blood cell production, including B and T lymphocytes, precursors. The D. Tonsils, adenoids, the Peyer's patches. I have a picture so you can see exactly later in the video. Lymphoid tissues that guard entry points, mouth, nose, GI tract. Lastly, we have the cells of the immune system, the lymphocytes, the white blood cells, the neutrophils, eosinophils, basophils involved in the first line defense, lymphocytes, the B and T cells for adaptive immunity, dendritic and mast cells, bridge innate and adaptive immunity, important in allergic reaction. Proteins like cytokines complement the system signaling and attacking the foreign cells. Here we have the physiology. So the physiology is innate immune response, the adaptive immune response. Third, changes in the aging immune response. We see age-related. The age are noted to have a decline in T cell function and antibody production when exposed to specific antigen challenges. They also tend to have an increase in circulating antibody levels, leading to autoimmune disorders. And here I have in this little slide here the like more outline, and you see in innate immune response. Non-specific immediate response includes physical, which is skin, chemical, the stomach acid, we like that, and the cellular barriers, the neutrophils. B. Inflammatory response, redness, swelling, heat, pain due to immune cell activation and histamines release. C. Adaptive immune response, specific immunity developed after exposure. Humoral, B cells produce antibodies, so after vaccination. Cellular, T cell target and destroy infected cell, virus infected cell. Assessment, we have the nurse will obtain a comprehensive history and performing a A complete physical examination will assist the nurse in assessing a patient's immune function. The laboratory and other diagnostic tests are also helpful in the assessment of immune function. And here, remember in the concept map, in that little boxes, I put the history, ask about recent infection, chronic illnesses, vaccination, family history of autoimmune disorders, physical examination, observe for lymph nodes, skin integrity, skin of infection or inflammation. 3. We inspect, look for rashes, swelling, wounds, and abnormal growths. 4. Auscultation, listen for abnormal lung sounds, crackles in pneumonia from suppressed immunity. 5. Palpitation and percussion, check lymph node enlargement or tardiness like cervical, axillary, and inguinal. Moving forward, here with diagnostic studies. The diagnostic studies are blood test, skin test, bone marrow aspiration and biopsy, and radiological imaging may be necessary to evaluate the state of individuals' immune competence. Also, we have immune deficiencies that may occur, can be primary due to aberrant development of immune cells or tissue, or secondary due to outside interference of the normal immune system in nature. So it also includes the CBC, the blood work with differential immunoglobulin levels, and other tests here like T cells, ESR, and example low CD4 count in HIV, high eosinophils in allergic disorders. So the book shows like super nice, huge tables. It's good if you have as a print rather than ebook. And you can see the nice printed there about each cell, what they do. Nursing implication, monitor for signs of infection, of course, support the patient during the bone marrow biopsy, and educate them on the test purpose. So we're getting close to the end of the chapter. Yay! So the age-related changes, immune competence may decrease as the immune system changes and weakness with age. Aging has been noted to negatively affect both the innate and adaptive immune responses. Immunosensine refers to those changes that occur with aging and their consequences: increased infection risk, increased risk of malignancy, and increased autoimmune disorders. Pneumonia and influenza are seen as much higher rates and are included in the top 10 cases of death for individuals 65 years of age and older. So as you see, they have a slower immune responses. So it's a safety alert, say in the book, about nutritional status is critical component of immunocompetence. So the cellular immunity, phagocytes activity, and complement ability are greatly affected by protein deficiencies. Because of these, patients who suffer from malnutrition are more susceptible to infection. So here the immunosensins refers to changes the immune system that occur with aging and their consequences. Increase infection risk, increase risk of malignancy, I said earlier, and increase autoimmune disorders. Age is an essential factor to consider when assessing immunocompetence, which is immune competence may decrease as the immune system changes and weakness with age. So, for instance, certain medication like antibiotics, anti-inflammatory, and immunosuppressive agents, the anti-metabolites, anti-neoplastic agents, and thyroid suppressive therapy can also have substantial immune system side effects. So it is essential to know that the clinician and patient are aware of those medications and their potential impact. We are at a small little summary of the chapter. So the summary is like the components of this immune system. So it's lymphatic system, lymphoid organs, cells and proteins of the immune response. So the lymphatic system is like the function defense body against microorganisms, maintain fluid balance. Structure is the lymphatic vessels transport lymph. Lymph fluid carries immune cells and proteins. Collecting ducts drain into venous circulation. B. Lymphoid organs. Primary and central is the bone marrow. Its origin, all immune cells like B cell maturation. Thymus is the T cell maturation. Secondary, so peripheral, is the spleen, which filters the blood, stores immune cells. Lymph nodes filter lymphs, trap antigens. The tonsils and adenoids protect respiratory tract. The Peyer's patches protect the gastrointestinal tract. We have cells and proteins of the immune response, so like leukocytes, neutrophils, monocytes, macrophages, eosinophils, NK, the killer cells, the lymphocytes, B and T cells, proteins like cytokines, and complement system antibodies. So immunity of lines of defense. So we still are in the summary. So we go again kind of to revise and kind of make it the structure in case you get the quiz, you have it better aligned this way. So the immunity lines of defense are the innate immunity, first and second lines of defense, and B, which is adaptive immunity, which is the third line of defense. So here are pretty much quizzes question. So the first line is the barriers. What do we know about the barriers? So it's physical skin, the mucous membranes. It's also the biochemical, like secretion, enzyme, pH, normal flora, genetic, psychologic, like specific resistance. We have fever. So the second line, which is inflammatory response, non-specific, rapid, no memory. So the key process here is the interferon activation, complement cascade, phagocytosis. And then we have the cells, the neutrophils, the first responders, the monocytes, macrophages, long-term cleanup, eosinophils, it's parasitic defense, the natural killer, the NK, the killer, it's for virus and cancer surveillance, the cytokines regulate inflammation, local inflammation signs like redness, heat, swallowing, pain. B, so that was the first and second. So the first line was the barriers, the second line is the inflammatory response. Now we are category B and has 3. So the B is the adaptive immunity, the third line. Definition. Specific response is memory develops after exposure to antigen infection vaccine. We have 2 types, cell-mediated, where the cell activation, you see here the cytonic T cells, helper T cells, it's those pictures that you see have the stages of antibody mediated, the B cell activation, antibody production, and 3 forms of immunity, active and passive. Active is self-generated, like infection, vaccine. Passive is donor deviated, derived, like a placenta, breast milk, immunoglobulin therapy. We're almost there. So the competence versus incompetence of immune system. So the immune competence is to prevent entry of pathogen, destroy abnormal malignant cells, provides long-term memory protection. The B, immune incompetence, it's the outcome allergies, recurrent infection, cancer, susceptibility, autoimmune, and immunodeficiencies disorders. Contributing factors, we have age, like infants, immature, elderly, the weakened, weak net. So it's the weaken. Medication, steroids, chemotherapy, nutrition, it's protein, vitamin, genetic, inherent immune disorders, stress, physical, emotional, cortisol suspension, and illnesses, chronic disease burden. We nursing, our clinical implications, nurses need to understand and teach about immune incompetence can lead to allergies, infection, cancer, and autoimmune and immunodeficiencies disorders. So age, medication, nutrition, genetic, physical, or emotional stress, we said earlier, and illnesses, the chronic one, can all affect immunity and immune responses. Their by influencing the overall function of the immune system. So again, the assessment, the lymph node palpation, infection risk, immunization history, patient education about vaccines, nutrition, infection prevention, intervention, protect the immunocompromised patient, reverse isolation, infection control. And here it's a little bit about NCLEX like immunocompromised infection prevention priority, like allergic reaction airway management priority. Then we have autoimmune disease, immunosuppressive therapy monitoring. So this is an overview of this assessment of immune function. And this is like how to say, like a little a fresh up. So now we go next. So let's do a practice quiz. Which type of leukocytes releases heparin as part of inflammatory response? Leukocytes. So you need to think about leukocytes. It's basophil, eosinophil, monocytes, neutrophils. So it's inflammation response and heparin as part of inflammatory response. So it's basophil. The nurse recognizes that which immunoglobulin, the Ig, is a mediator in allergic response. So allergic response for the Ig. So the correct answer is IgE from elephant. So the nurse recognizes that. The nurse correlates which of the immunoglobulin, again Ig, are playing a role. Oh, I just said already. Reading twice. So it's IgE. The nurse is teaching a new mother the immune benefits of breastfeeding her newborn. The nurse bases this teaching on the understanding that which immunoglobulin, the Ig, is passed from mother to newborn through breast milk. I just said earlier, goes through the breast milk. So it's IgA. I think the way to remember this for the breast milk with the newborn and passing from the mother to the newborn, I think the first step on the baby, it's A, B, C, D. So the first step, it's A. This is a numeric. So this I will remember if I see in the quizzes. So immunoglobulin is passed from mother to newborn through breast milk is the IgA, A as an apple. The nurse educates a patient on the first line anatomic barriers to infection, which patient statement indicates to the nurse the need for further teaching. Vomiting is an anatomic barrier to infection. Coughing is an anatomic barrier to infection. My saliva is an anatomic barrier to infection. My skin acts as anatomic barrier to infection. So the nurse the need for further teaching. My saliva is an anatomic barrier to infection. The nurse correlates the function of the thymus gland to which outcome? White blood cell development, T cell development, cytokine production, B cell production. It's the T cell. It's in that little summary. We said that on the Times gland, which T cell, which it's the T cell. The nurse is teaching a group of patients about first line defense. So what's the first line defense against infection? Which patient statement indicates the need for further education? The skin is the first line defense against infection, so it's correct. A sneeze is a mechanical first line defense against infection. My saliva is a biochemical first line defense against infection. I said exactly those examples in the summary. A cut with pus is mechanical first line defense against infection. So this is the wrong here. The nurse needs to do the further education to this patient who said a cut with pus is a mechanical first line defense against infection. We do another one, and the last one, promise. A nurse is caring for a patient with who is experiencing leukocytosis when providing care to this patient. Which action by the nurse is the most appropriate? Assessing for the source of infection, assessing for bleeding and bruising, placing the patient in reverse isolation precaution, instructing the patient on the use of electric razor and soft brush. So the nurse is caring for a patient who is experiencing leukocytosis. So we provide this care, which action by the nurse is the most appropriate. So we assess the source, assessing the source of infection. So now we go next. Here you can see like the monocytes, macrophages, how they divide, the natural killer, the eosinophils. So this, I think it's you see the helper T cell, memory B, the B cell, plasma. So this is a little review. So now we go next. Here you can see, I like this picture a lot. It's primary, secondary, physical barriers, and immune roles. And in this side, you can see the ING, INGE, INGD, and INGA, the breast milk one. So now we go next. As you see here, it's the pairs patches. I like these pictures. This was in the beginning when I searched, and I like this. So this you can see. You can search too, and you can see a lot of pictures, really pretty, in case you need to review. So now it's my time to check out and tell you goodbye and thank you. So now we go next. Thank you so much for being here with me today. I hope this video helped make things feel a little clearer and less overwhelming. If this supported your learning, please give it a like or share it with your fellow nursing students who might need this too. Everything we cover connects back to the real nursing, wherever it's recognizing a lab, planning safe care, or knowing what to teach a patient. Let me know in the comments below, what was the most helpful thing you learned today? What still feels unclear or confusing? If this was what you hoped, and make it easy for you. If you can also let me know if you like the notes for this chapter. Check the description. I usually add some free resources there just for you. Thank you again for your time and trust. I'm Nurse Mia, and from my heart to yours, until next time, stay zen, stay grounded. Namaste. Bye for now.